Wave of COVID-19 infections has hit India hard. A number of cases skyrocketing with the healthcare system pushed to the brink. Let's take a look at the statistics to assess the impact of COVID-19 specifically on children and young adults. As per the data from the Union Health Ministry, 79,688 children have been infected in the 5 worst hit states between the 1st of March and the 10th of April. Let's break down the numbers further for you. In Maharashtra, 60,684 children tested positive. Over 9,000 are below the age of 5. In Chhattisgarh, 5,940 children have contracted the COVID-19 infection. In Karnataka, 7,327 children tested positive. 871 of them are less than 5 years old. In Uttar Pradesh, 3,004 children have been infected, while Delhi has logged 2,733 infections among children, 441 of them below the age of 5. The fresh surge in COVID-19 cases witnessed more pediatric cases in those over 10 years of age and also between 1 to 8 years. Among other symptoms shown by children are a blocked nose, abdominal pain and diarrhea, apart from sore throat, weakness, fatigue, loss of appetite, exhaustion and headache. Owing to the increase in number of infections, the central government has now also postponed the CBSE Class 12 examinations and cancelled the Class 10 board examinations. Currently, there is no vaccine available for use in children across the world. AstraZeneca vaccine, the testing on children in the UK has been suspended. Moderna is testing doses on participants aged between 2 to 12 years, while Pfizer had earlier declared that its shot is 100% effective in children aged between 12 to 15 years. Joining us live on the broadcast is Professor Michael Enial, who is a virologist and professor of biochemistry and bioinformatics at the Hebrew University of Jerusalem. Thanks very much, Professor, for speaking with us. An increasing number of younger people, even children, contracting the COVID-19 infection, the fresh wave that is sweeping across several parts of the world, including India, unfortunately revealing this trend. What is your assessment of the reasons behind this? And to what extent should this be attributed to the mutant strains of the virus?
Yeah, so those are excellent questions. Let me just say that after having the pandemic with us over 1 year, we learned quite a bit about it. And some of those kind of new discovery are pretty old, in fact. What I mean by that is that we knew already quite early that young people, indeed, below the age of 10, are somehow protected from the SARS, from the COVID-19. However, they are still carrier. Namely, if we would do the test, like the PCR test, we can still see them as infected. And this really caused some confusion. Many people say kids or children are protected, but that's not the case. They are not getting severe illness, which is very important. But most important, I think, to know, to understand, is that kids and children reflecting their surrounding. Namely, if the family has disease, they will be a carrier. If, for example, in Israel, which, as you all know, the situation is really that COVID-19 basically is not there anymore. Children have zero. Really, they're not carrier anymore. Therefore, schools were open, everything was open, and so on. But in places where, like in India, or some places in India, where the infection and the pandemic is really hitting hard, children will keep being carrier. So it's really a reflection more than anything else.
All right, so what would... Yes, go ahead.
Yeah, a lot of people really ask what make children, let's say below the age of 10, so protected in a sense versus the adult. And there are at least, I would say, 4 hypotheses. One seems to be really clear, that it's something in the biology of the children. What I mean by that, it means that somehow their immune system is developing so that it will be less sensitive so they have like an extra protection. It could be from 2 reasons. One, which is most people believe, that their innate system, the system that they were born with, is by far at a better state to compete with pathogen, including the COVID-19. But the other aspect is that maybe they have less accessible of the receptor that should be the entry point for the virus to get to the lung. And both stories are indeed the case. More important, I think, is the fact that about the infected children, they only have 50% chance to infect other if we compare them to adult. So there are more than one element that makes the children very different in this aspect. By the way, an interesting hypothesis that have very little support is the fact that their bacteria, their microbiome in their guts, in their mouths, is somewhat different, right, giving a higher protection.
Right. The immediate question that arises then is that there is no vaccine that has been approved for use in children as of now. There was positive news earlier from Pfizer, which declared that its shot is 100% effective in children aged between 12 to 15 years. Should governments across the world give a more serious look at vaccinating the younger population, considering these numbers?
Yeah, so that's a very good point, and it's a very, very good result from Pfizer and probably Moderna as well, that those type of vaccine are super effective for children from the age of 12 to 15. Actually, there was no difference between age 12 to 15. So it's a good, I would say, prediction that probably also younger people would have been very well responding to the vaccine. However, in terms of numbers, from the population, like a demographic, having another bunch of people like 12 to 15 being vaccinated really changed I would say, the progress of the COVID-19. So each chunk in the population that can be vaccinated, it's a very good news for the population in general.
Right. Professor, thanks very much for joining us with those perspectives and helping us better understand.
For everybody.